I'm Dr. Sheri McKinstry. My traditional name is Wabishkimatana Mojitadakwe. That means White Horse Warrior Woman. That name was provided to me in ceremony way back in the late 90s. And with my name came the responsibility to protect those that needed protecting. It is a responsibility that I take quite seriously. And that's kind of what brought me here to IDAC as well. So I'm actually speaking to you from Treaty 6 territory in the homeland of the Métis. I am a pediatric dentist and I'm Status First Nations. I'm registered with Saugeen First Nation in Manitoba, which is located on Treaty 1 territory. I have family ties in Manitoba to Saugeen First Nation, where I'm registered. I'm with a family there. I have family, historically, I guess my ancestors would be located in Peguis First Nation, Fisher River First Nation, Little Black River, Manigatogan, which was also known as Bad Throat, which is a Métis community actually, and so the others were First Nations communities. I have a lot of family right now back in the Pine Falls area, but pretty much all throughout Manitoba, I'm related to somebody somewhere in Manitoba. Many of my family are there, but I am starting to locate friends here in Saskatchewan. Yeah, that's me in a nutshell. I'm a mother of 4, been with my husband for a very, very, very long time. All of my children are grown, and I have yet to have grandchildren. And that part's very important for me. A lot of what I do is actually to pass on, I guess we would pass on the baton to somebody who's going to continue on this work. But the reason it's really important for me and for IDAC actually is because we're trying to create change for those that are coming behind us, and that includes my children, my grandchildren, if I ever have them, and my great-grandchildren and children beyond that. It's all about future generations, and so this is why IDAC is here. IDAC, I guess the development and I guess its origins came from, I guess it would be a lot of my personal experiences, First Nations women in not only the academy, but also in society as well. So I grew up with a very, I guess it would be a difficult childhood, but, I do have a lot of memories, really good memories to go back to that make some things bearable. And so coming into the institution was quite difficult, actually, to be able to function and make it through and tolerate a lot of the things that I had to tolerate going through. But IDAC, the very first thing, and I've been through programs in different institutions here in Canada, and the very first thing that I do is I look for Indigenous community in those institutions that I go to. For example, when I got into university, I had gone into the University of Manitoba, and it's interesting how everything fell together because I actually got into university a little bit earlier than I thought I was going to. So I was a high school dropout. I got into different programs. They called me an educational butterfly. So I just kind of picked up courses here and there. And finally, I was doing this last course that got me the minimum credits that I needed to get into the university. I guess it would be as a mature student, which turned out I finished the course, did really well in the course, which means the deadlines worked out a little bit more, I actually just would have been admitted into the Faculty of Science at the University of Manitoba with what I had. It just took longer for things to come through. But at the same time, I had applied to the Access program, which was, at the time, I don't think it was specifically for Indigenous students, but because of those, when you're using an equity lens, those that have not had the experience, those have not had the family, it was I guess for me, when I had read about this Access program, it was about creating Indigenous community and support for Indigenous peoples coming in that didn't have that background, that wanted to be there, but they weren't, I guess the outlook and the chance of success were decreased because we haven't had that experience. And so I applied to this program at the exact same time, got in on my first year, went through the orientation, met a lot of great people, a lot of people that had the same background as me, and got to meet new people and because where I grew up, I also didn't have a lot of I guess it would be experience and travel experience, world experience. I hadn't even been out of where my area, actually. I hadn't even traveled really into Manitoba much at all. So meeting all these people and bringing all these new perspectives, I was learning so much and learning from everybody and got to hear all of those stories. And so that experience actually, I guess, brought together the idea and the foundation of IDAC of just bringing capacity into an organization. And this is something that was lacking in dentistry. So I thought that part was very important. And that's kind of like the foundation. I would say the reconciliation of the foundation, because we're even building our community when we're Indigenous people are coming together. We're still building that community. We are all at different points in our healing journeys and our experiences, our lived experiences. So this is kind of what brought IDAC into, I guess it would be, into fruition. It was just trying to bring together all of that, all the Indigenous people. And originally it had started out with just Indigenous dentists that we were going to. Then I kind of opened it up a little bit more because, even coming through the residency at the University of Manitoba, there was so much I learned from the dental assistants there. That we just have so much to learn from each other as a dental team. Anyway, so that's kind of how it started. But then with all that ideas and bringing it together, we incorporated, there was the news that we were hearing about the undocumented I guess we could easily say the burial sites at the residential school systems. Anyway, so that was hitting the news, and it was hitting me quite hard because my family has been a part. They were a part of the residential school system. They didn't talk much about it. My dad said he was a part of the residential school system. He never talked about it. So it's always hard to know exactly the hardships that I grew up with and what that had to do with what he had experienced, because he just never talked about that stuff. But anyway, that hit me quite hard. And I guess in the whole process of trying to deal with that, reconciliation had been in, I guess, the forefront for me in dentistry from my Master's of Public Health at the University of Victoria, where I did my project, and it was reconciliation in dentistry. Anyway, so this is where reconciliation came from with IDAC. And so it was kind of like a whole, everything that was happening and all of the evolutions. And I think with IDAC, it was the whole bringing Indigenous community together, and then eventually bringing, with everything that had happened, is bringing all of the dental community together. And so this is the foundation, and this is what IDAC is built on, and that's how it came to fruition, is, me looking for Indigenous community across Canada, because we were so isolated working in dentistry. So it was bringing community together, and then it was reconciliation, bringing everybody together, considering all of the issues that we're dealing with in society today. And I have a feeling that it will still evolve as we evolve and start working through reconciliation as well. But that's how IDAC came about. One of the most important parts when I was talking about my experiences, a lot of these cannot be understood from a non-Indigenous perspective because you haven't made it through. It's a very unique Indigenous-specific racism is very Indigenous-specific. And unless you've had those experiences, it is impossible to understand. To listen to somebody and tell the stories, it seems like it's so far out there. If I were to share my whole story with everybody, they would say, no way. There's no way that happened, right? Unless I was saying it out loud, and even then it may sound unbelievable. But to have that, there's no way you can empathize really unless you've had those experiences. You can sympathize as you hear the stories, but you cannot completely understand the whole context unless you've lived those experiences. And in order to have that context, you have to have somebody at the table that is a part of that discussion. And so we're still at that same spot when it came to trying to identify what discrimination and what racism looks like. And so that's the very first one, is we need to be able to recognize that. And a lot of that has to do with, upholding the status quo, what we have in our backpack, and it's being able to unpack that backpack first in all of those biases that you come with, right? And once you are able to do that, then you're able to hopefully open your heart and try to listen to those that are saying that they're being harmed. and then coming up with a solution for that. But I guess my concern is that we are going to be hearing a lot more people speaking up and not taking things anymore, because those doors are opening for us to be able to be heard. It's even for me and the institution previously, our fallback was to get out of those situations. It wasn't to confront them. It was to get out of there. We ask frequently, how come, Indigenous people don't make it through programs and this and that. Well, that's the very reason why. Even in my program, I just about left program, and now I've left an institution because those environments are very harmful. And in order to protect ourselves, we just leave. And I think we're coming to the point in society where we're getting away from that reaction of just protecting ourselves and surviving. And we're starting to confront and speak out a little bit more. So we need to make those spaces to be heard, for them to be heard when we say things are happening. That is the biggest one, is just listening, paying attention, and stop brushing them off. So what IDAC is built on is reconciliation. So, joining membership is a really big, it was a really big one, because the more voices we have in IDAC, the more perspectives we get. And so with those reciprocal relationships, I think that with IDAC, this is what we need. We always talk about those being allies. Well, there's a newer term, and it's called accomplices. And it's those that are willing to actively be the ally. And that's part of speaking up and changing how you do things to help create those spaces. So it's about relationship building. We're looking for relationships. We're looking to be accepted. Part of not being, I guess it would be the other in these situations, but also just having that reciprocal relationship where we can get to know each other. We're moving that barrier of the unknown, I think, is an important part. We've had such support from Indigenous Services Canada that has made this all possible. So I'm not sitting in the basement, getting things done from the basement. It is because of Indigenous Services Canada, actually, that we're able to build our training center and to open up the doors for Indigenous oral health providers to have relationships in research with non-Indigenous, or even Indigenous and Indigenous communities, or even Indigenous communities coming in. And I have to say, and that is one of the biggest sense of accomplishments. And what I'm looking forward to the most is when I was up in one of the communities, we heard community say that they'd be so happy to come to IDAC and talk to oral health professionals and let them know what they wanted, what they were expecting, and their bad experiences, so that they don't get repeated. But more, it was just they wanted to come talk to oral health providers so that they could create that relationship and let you know that you're welcome in our communities, but there are certain things that we have to do, but we need to have a trust first before you come into our communities. And so part of that trust is building relationships before you come to our community, so that who we are, so that we can be prepared and things along that line. And so, just having the ability to continue on with those projects, and in any support, in any way, we're more than happy to have, anybody reach out to IDAC. We're more than happy. We're more than willing to sit here. Ideas. Another one that we would really appreciate as well is on our website, we're trying to build I guess it's not so much a repository, because we were offered IDAC to become a part of another Indigenous organization that holds a lot of the research that's being done by Indigenous peoples. But if we're trying to gather resources, so those that are interested in Indigenous oral health have the resource where they can come to one page and it's all there, right? And so what we're trying to do is build that as well. So if we have researchers and those in academia, those in communities, and those even that are in academia that don't necessarily publish but have great literature, then those that are willing to share that as well. We're more than happy to have everybody reach out to us. Anything Indigenous oral health, we're more than happy to take it on, because IDAC is going in a way and in a direction that's driven by what we need. And so if we have those reaching out to us, telling us, that, oh, this is interesting, or this is what I heard, and that's what we're looking for. IDAC is actually endeavoring to declare October 1st as Indigenous Oral Health Day. And the reason that we're doing that is, number one, it's part of our reconciliation journey as we're trying to bring it to light, because Indigenous, well, oral health, I should say, is always kind of put on the back burner of everything. And what we need to do is highlight the Indigenous oral health inequity that's happening across Canada. And what we're trying to do is bring together everybody. We were endeavoring to do it at the beginning of a school year so we can capture children, but also make dental profession available to those in school, especially, the youth and those getting into, and, thinking about their careers and where they're going to go. Just making this a day where it makes dentistry accessible to children, especially when that is not accessible in the communities. And so this is what we're trying to do, is we're trying to make it accessible, even if dentistry and oral dentistry itself is not accessible. Because if we're not in the communities providing dentistry, then we're definitely not saying that dentistry is accessible to those that are in the community. And so what we're trying to do is get into all the communities. And this is how I'm hoping we're going to get into the communities and providing, oral health in the communities, and it'll be right in the schools. But we wanted to respect. One of the things that stuck with me with Orange Shirt Day is Phyllis was talking about the September being the Crying Moon Month, is because when children are being taken away to residential schools. So we wanted to respect that month and let that month be a month of healing. And so we'll capture them also before Halloween too. So we're thinking that, but most of all, it's also, creating that knowledge and bringing oral health and making dentistry available to children at the beginning of the school year, so that we can be thinking about that throughout the year.